Good morning to one and all. I am Vadarevu Soni, in charge and assistant professor, Department of Home Science. Today, as a part of health hygiene and wellness, we are going to discuss about the various viral infection. In that, we are going to talk about the definition, causes, mode of transmission, symptoms, and prevention of influenza, measles, and polio. Let's go into details of each infection. So coming to influenza are also called as flu. It is defined as as a viral infection that not only affects the respiratory system, it also includes nose, throat, and lungs. It is very contagious. It is caused by the influenza virus and can lead to different and mild to moderate illness to severe also, sometimes resulting in complications like pneumonia. The symptoms like headache, body aches, sore throat, fever, and respiratory system are being observed, which can be severe. Flu is the most commonly winter flu when many people get sick at once. Influenza or flu is also caused by influenza virus. It is contagious as I was talking about, the most respiratory illness and may lead to mild to severe illnesses. And in that you have four varieties. The influenzas A, influenza B, influenza C, and influenza D. In influenza A, it is a seasonal flu and can show symptoms which is also a pandemic symptoms. For example, you have seen H1N1, that is swine flu, and bird flu, which is most commonly seen in influenza A viruses. Influenza B viruses, which is a seasonal flu but does not lead to pandemic. Influenza C is they causes a mild respiratory infections, and D primarily affects cattle and does not infect any human beings. So these are some of the causes of influenza or virus or flu. So now let's see how does it get spreaded or the mode of transmission. It can be our airborne droplets or a direct contact or a close contact. Let's go into depth. So, if it is an airborne, when an infected person either coughs, sneezes, or talk, they releases virus which through the droplets, and it can be inhaled and go into your move towards your lungs. Direct contact, but touching a contaminated hand objectives or other person's hands or surfaces, and then touching the nose, mouth of your or eyes of yours, that can also help in transmission. And the close contact being in a crowded places or a close quarters with an infected person. So these are some of the ways and how the flu is being spreaded from one person to other through an airborne or a direct contact or a close contact. Now coming to the symptoms of an influenza, if it's a clear picture, you have a severe headaches, joint pains, intestinal disorders like diarrhea and vomiting and nauseas. You have a very severe fatigue, tiredness, and feeling run down. Congestion in your nose. That is, as we said, it is respiratory disorders mostly. So you have a runny and stuffy nose, sore throat, extreme tiredness, coughing, headache, cough, body aches, chills, and fevers. These are the most commonly frequently seen symptoms observed in the flu conditions. Now, what is the most important thing you have to do? That is the preventive modes. So, first thing is vaccination plays a major role. Annual flu shots helps to protect against any common strains. Hand hygiene, washing hands frequently with soap and water or any detergents. Respiratory hygiene plays a major role, covering mouth and nose with a tissue or elbow or using a mask while you are coughing or a sneezing part. Avoiding close contact, stay away from infected individuals. Disinfectants, use sprays, cleaning and sanitization frequently with the touched areas or surfaces, and healthy lifestyle, eating nutritious food, staying hydrated, exercising, and getting enough sleep and to boost your immunity. Using expectorants like you have seen Ascoril, you've seen ads also. Most of the ads also say when you cough, use an Ascoril, where it easily clears your mucus out of your lungs. So these are some of the preventive measures where you can prevent from a influenza virus or a flu. Now coming to the next part of a viral infection, measles. In picture you can see measles was very most common once a day, but once a year, but it is not so much now. Now what is this measles? How can we define measles? It is a highly contagious viral infection caused by the measles virus. It primarily affects the respiratory system and spreads rapidly among unvaccinated individuals. It is an airborne disease and it is very, very contagious. Symptoms may slowly develop about 8 to 12 days after you have been exposed. Symptoms can last 10 to 14 days. Measles is also called as rubella, which is 10 days measles or red measles. What are the main causes of this measles? Measles is caused by an extremely contagious virus, Morobilovirus, right? Then it mainly infects the respiratory tract and then spread throughout the body. Contaminated droplets that are spread through the air when you cough, sneeze, or talk, or kissing someone who has measles, or sharing drinks or food with someone with measles, shaking hands or holding hands or hugging from pregnant people to their babies, either during the pregnancy time or delivery, or even while lactation or nursing. So the main track is airborne droplets. When an infected person coughs, sneezes, or talks, releasing virus laden to the droplets, or direct contact, also touching contaminated surfaces or objectives and then touching the eyes, nose, or mouth, or through airborne particles. The virus can remain suspended in the air and then, when inhaled by the others, it has been transmitted to the lungs. So, these are some of the way how you're getting your measles. It can take 6 to 21 days to develop symptoms of measles after you have been infected. This is called as incubation period. Yeah, as I was talking earlier, the different mode of transmission, it is like airborne droplets, direct contact, airborne particles. You can see picture how a crowded area, first picture, infected droplets in crowded space, how many people among them, if you see the picture among them, if anyone have been infected with this kind of measles, it is easy transmission from person to person. And if you see direct contact, shaking each other hands or hugging also, and the other one is droplet modes, where contaminated person when sneezes or coughs, the droplet will be stayed in the air for a few longer time, and that has been inhaled by a healthy person, then he has a chance of getting this disease. Now, coming to the main causes and symptoms and causes, here some of the symptoms you can visualize it: a high fever, tiredness, a barky cough, red or bloodshot eyes. You can see this picture where I presented you the bloodshot, a runny nose, a red rash, which I've shown you in the earlier, which start at the head and then spread downwards. And other symptoms are like sore throat, white spots in the mouth. So, this is an example that is called as oblique spot. You can see all white patches on your overall mouth, and muscle pains and sensitivity to light, where you cannot see a light in a direct rays. So these are some of the symptoms. And recovery phases can be symptoms gradually improves within 7 to 10 days, but complication can occur also. Right. So what are the main preventive? We know for everything there are prevention methods which have to be taken care. So vaccination, as we said, measles, mumps, and rubella (MMR). We know MMR vaccine is now is being in the immunization schedule from the beginning. First dose is at 9 to 12 months. Second dose is 15 to 18 months, and the booster dose is 4 to 6 years. Before you enter into a school, it is a preschool period time. You have to take the shots. Then isolation of an infected individuals, mainly this isolation is to prevent spreading infection from one person to the other. Hands and respiratory hygiene, that is what I'm saying. Continuous washing of your hand with various detergents and covering the mouth while coughing or sneezing. And vitamin A supplementation also helps to reduce the severity and complication and infected children. I was talking about MMR, that is measles, mumps, and rubella vaccines, and also MMRV also, which is measles, mumps, rubella, and varicella vaccines. So these are the two vaccines which have to be used. So these are some of the preventive methods where you can stop spreading the infection from person to person or through the airborne. So so I think this is a clear picture for you for the measles. So next is we're going to talk about the polio. So polio is also called as poliomyelitis. Before, this disease was very, very much famous, and mostly you can see polio people on the street side. But the this has been slowly been eradicated due to many government initiatives. So let's go into depth of this polio. It is a disease caused by polio virus. So if you see, I've in the picture, there's a clear picture how the virus is. It's a round shape. It is spherical in shape. Like you, it can be a somewhat like a COVID. I suppose it's like a COVID virus. So it causes mild or no symptoms in the most of the people, but in some people it can cause paralysis to a particular part of your body, or it can be your leg, or it can be your hand, anything, or also sometimes it can lead to death. There are three types of variations of polioviruses, which are called as WPV1, 2, and 3. This WPV is wild polioviruses type 1, 2, and 3. The wild polio type 2 and 3 have been eradicated long ago, and while the polio type is now there in a very, very few parts, I think especially you can see mostly in outbreak. This most outbreak is in other countries rather than us, right? So this is the most common paralysis which we can see. Now, coming, how does polio affect my body or our body? It gets enters in your body through your mouth or a nose. It can be, you can call it as oral mouth, or oral mouth throat. These through a respiratory droplets also you can call. This virus multiplies in the intestines and spread through your stool. So these are some of the modes how you're getting, how your body is getting infected. So it makes more copies or reproduce in your throat and guts, that is intestine. In some cases, it gets into your brain and spinal cord and causes paralysis. Paralysis can affect your arm, legs, or muscles that can't control your breathing. If you see the picture, you can see this child is poorly affected with the on the legs part, especially, and she has been paralysis also. Her legs, she doesn't have a proper tone of leg, right? So, what are the causes? As we were talking, poliovirus is a main cause. It infects your throat and intestine, causing flu-like symptoms. We already spoke about what is flu. It can spread to your brain and spine, causing paralysis. Now, coming to the most important thing, what are the symptoms you observe during the polio? So, the symptoms are like fatigue, fever, headache, vomiting, diarrhea, constipation, sore throat are some of the things. They're all mild polios. If it is a non paralytic polio, that is 1 to 2%, it has been seen. Where stiffness in the neck, if you can see a stiffness in the neck, back, limbs without any kind of paralysis. Then paralytic polio, you can say muscle weakness leading to permanent paralysis using in the, especially in the legs. That asymptomatic polio means there are no symptoms, but you can spread the virus. So these are different types, or you can say polio has different forms also, you can say, where asymptomatic you can say mild polio, non-paralytic polio, or paralytic polio are some of the types of forms of the symptoms we observe. To all these things, what is an incubation period if we talk? It is 3 to 35 days. Average 7 to 13 days, you can say it's an incubation period. So, who are the high risk groups for this polio? Unvaccinated individuals, children under 5 years of old, and people living in a very, very poor sanitation area are more scope to this kind of infection, viral infection. So, let's see what are the preventive methods. So first thing is polio vaccination. We know the government has taken a very good initiation, oral polio vaccinations that is given orally to everyone. The first dose, first shot of 2 months old, second shot at 4 months old, third shot between 6 to 18 months old, and booster shots between 4 to 6 years old, which is being given by the government to the people. And second thing is good hygiene and sanitation plays a very, very major role. Avoiding contaminated food and water, using heat packs to get the help from the muscle aches, drinking fluids like water, juice, or any kind of broths, taking pain relievers such as ibuprofen or crocin, or you can say aceclofenac, doing physical therapy and any exercises recommended by your healthcare provider. You just can't take your decision only under the guidance of physiotherapy. You have to do some physical therapy and getting plenty of rest. So these are some of the things, and the main treatment is physical therapy is very, very must if you are detected with a polio, and a pain management and use of ventilators if breathing is affected. So these are some of the viral infection which I spoke about. These are very few which we discussed today about the influenza virus, measles virus, and polio viruses. There's still many more, but to this we can conclude saying that only with preventive methods we can make it an end or eradicate few of the disease conditions. As we know, COVID, most of it now, COVID is become a seasonal flu. Like that, we can eradicate few of the disease. Right? Thank you. I think you understood. Thank you, girls.